CAISS Face Exam. Question 1. What makes up the posterior chamber of the eye? Area between the cornea and the iris. Area between the retina and sclera. Area between the iris and lens. Area between the vitreous and macula. Area between the iris and lens makes up the posterior chamber of the eye. Question 2. Where is the macula located? On the lens. In the eye, on the retina. In the anterior chamber. On the cornea. In the eye, on the retina. Question 3. What is the function of the retina? Focuses light onto the lens, controls the amount of light entering the eye, maintains the shape of the eye, transmits light rays to the brain, by way of the optic nerve, to be interpreted. Transmits light rays to the brain, by way of the optic nerve, to be interpreted. Question 4. The sclera is also called what? Globe, retina, iris, pupil. The sclera is also called the globe. Question 5. What is the outermost layer of the eyeball called? Cornea, sclera, choroid, retina. The outermost layer of the eyeball is called the sclera. Question 6. When there is a laceration to the sclera, what do you need to know for coding? Size of the pupil, amount of vitreous fluid loss, relation of ora serrata and equator, distance from the optic nerve. When coding a laceration to the sclera, you need to know the relation of ora serrata and equator. Question 7. What is the vitreous portion of the eye? The fluid in the anterior chamber, the gel-like portion of the eye that maintains shape, the muscle that controls the lens, the outer protective layer. The gel-like portion of the eye that maintains shape. Question 8. What is the only injury that can be coded in the temporomandibular joint? Fracture, laceration, contusion, dislocation. Dislocation is the only injury that can be coded in the temporomandibular joint. Question 9. A transverse fracture through the lower maxilla, maxillary alveolar process, maxillary sinus, hard plate and lower pterygoid plate is known as Lafort-I, Lafort-II, Lafort-III, zygomatic fracture. Lafort-I. Question 10. Does a Lafort-II fracture line impact the orbital socket? No. Yes, only the right socket. Yes. Yes, only the left socket. Yes. A Lafort-II fracture line impacts the orbital socket. Question 11. What is epistaxis? Swelling of the eye, fracture of the jaw, ongoing bleeding in the nose, laceration of the lip. Epistaxis is ongoing bleeding in the nose. Question 12. Can you code epistaxis if there is a fracture in the nose or septum? Yes, always. Only if there is loss of consciousness. Yes, if bleeding is severe. No. No, you cannot code epistaxis if there is an associated fracture in the nose or septum. Question 13. A pyramidal fracture through the nasal bone, lacrimal bone, orbital floor, infraorbital margin, upper zygomatic maxillary line, maxillary sinus, lateral pterygoid and into the pterygoid-gopalatin fossa is known as Lafort-I, Lafort-II, Lafort-III, mandibular fracture. Lafort-II. Question 14. What are the four orbits of the eye socket? Rim, floor, medial wall and lateral wall, roof, base, anterior wall, posterior wall, apex, rim, inner wall, outer wall, cornea, iris, sclera, pupil. The four orbits of the eye socket are the rim, floor, medial wall and lateral wall.